two new members to the Alfred Deakin Institute in Geelong. We have Holly High and Miguel Vatter joining us today to share some of their research. And the event today is part of a broader series that we're doing at ADI Geelong. So when Chris and I took the co-convenership up earlier this year, we kind of looked around and at the various research projects underway and also at Miguel and Holly's work and thought that broadly we might organize some events that speak to the theme of the medical humanities. So next month, Miguel, Vanessa, and I are organizing an event on viral politics. So that's coming up on, I believe it's August the 27th. And we'll have the 360 theater at the Nile space at our disposal. We're working with a filmmaker who's been out on the streets recording conditions of lockdown in Melbourne. So we'll have a special 360-degree presentation, as well as speakers from around the world. So Miguel and Vanessa are working on a book called Viral Politics of COVID-19. We're also drawing on a group that has been working to visualize the virus. And then also some of the speakers come from the coronavirus multi-species reading group that I've been convening throughout the pandemic. Chris, do you want to say some more words about upcoming activities related to medical humanities at ADI Geelong?
Only that, yeah, so I have another thing that I'm working on at the moment called bioethical geographies, wanting to look at some aspects to do with how geography and space, particularly in the context of thinking of Geelong as a regional city, and how that COVID and many other examples of health and healthcare provision not necessarily evenly distributed through these geographical differences. And I think also, like, part of what Eben and I are trying to do here, and it's good to see some of our friends and colleagues from medicine in this meeting already, people like Emma and Cynthia, and I don't want to start naming too many people in case I miss anyone out, but to really try to establish some links with similar research projects going on in other faculties, as well as things happening in the Geelong medical community with Barwon Health and other related organisations where ADI research overlaps and can build some collaborative relationships.
Great. Well, thanks so much for coming, everyone. It is again a real pity that we can't be doing this in person, but hopefully soon these kinds of events will be possible in person. Yeah, great to see many colleagues here from Burwood as well. So without further ado, I'll turn it over to the speakers. And I actually don't have the lineup in front of me. Is it you first, Miguel, or Holly first? I can't remember what we did, or do you want to just decide amongst yourselves?
Can I? Sorry, can I just, as you know, I'm not going to be able to stay with you for too long.
Sure.
I've got too many competing things, but I just wanted to check in and welcome everyone and say we are really delighted that Eben and Chris are driving our suite of activities in Geelong. And welcome Marita to the team for all the support that you are providing now. And really we're wanting this to become basically a feature of these catch-ups but also targeted activities between ADI and the rest of our community in Geelong, including from within and outside of the faculty. And it's fantastic to see that this is taking on quite nicely, Eben and Chris and Marita. Thank you for all the hard work. And ADI will continue to be ready to really think about ways of providing even further support. As I said to you, I think, Eben, the good news is our new executive officer, she will be at least 2 days based in Geelong. So that's really fantastic injection of additional senior admin support to our ADI colleagues. It brings balance a little bit to the overall office that we run. And that obviously will be something that I hope will add value to what you're already planning to do.
Wonderful. Thank you so much, Betty, for those words of welcome, for the support that made this event possible and the upcoming events as well. So
no worries.
very much grateful.
I'll leave you to those wonderful presentations by Holly and Miguel, and look forward to next time to catch up with you for a little bit longer.
Great. Thanks, Betty.
No worries. Thank you all.
And in terms of lineup, apologies for not having the schedule in front of me, but Holly, Miguel, either of you feel like going first?
I believe it was Holly.
Holly, all right, you're it. Holly, go.
Okay, go. Okay, so I will share screen. Hello, everybody. I'm really looking forward to seeing some of you in person and finding ways for me to take part in this research community. So send me an email afterwards or in the comments, let me know if there's someone that you think I should definitely get in touch with as I start this research project. So I'm just going to say a few words today about my future fellowship, which I've been conducting for 3 weeks. So I can't give you any results yet, but I can tell you a little bit about why I came to this research topic. So this is some pages from a book that was published in 2015. Sorry, I used a photocopy. I should have used my mobile phone to take photos of it, but that was back in 2015. And it was celebrating the 40th year of the foundation of the Lao People's Democratic Republic. There are a few pages in this book celebrating the changes that had happened in mother and child health over the 40 years. So there was a postpartum woman depicted prone on a hospital bed surrounded by machines and a huddle of medical staff around her taking notes, no baby in sight. There were pictures of ultrasound machines and incubators, and the surrounding text was filled with statistics about improving health services and outcomes. More hospitals, more doctors, less maternal and infant deaths, and an increase in national life expectancy. The path to progress, these pages suggest, is being achieved in part through the steps taken towards technocratic birth. Birth itself is being born here, both sign and source of the coming modernity. In this book, there was no pictorial evidence of how most women in Laos actually give birth, in their homes, temporary shelters, or the forest, either alone or with friends and family, like this, and perhaps a traditional birth attendant if things don't go smoothly. You can see under here, I'm going to talk about Yufai or gum. These are hot ashes and they heat up. This is a woman who's just given birth and she's drinking hot water and lying over a fire. The official statistics in the National Strategy and Action Plan for Integrated Services on Reproductive, Maternal, Newborn and Child Health estimate that roughly 70% of births in Laos currently occur without any kind of medical care at all, biomedical care. The Lao government aims to halve this, along with halving rates of maternal, neonatal and under 5 mortality, and reducing by 2/3 the infant mortality rate, all by 2025. It aims to achieve this through an ambitious program extending free mother and child health care and services. So in brief, my future fellowship aims to investigate mother and child health policy in Laos, including its underlying values. And I come from a background of political and economic anthropology, so I'm particularly interested in how economic and political models play out through health policy. For instance, Laos is struggling with ballooning debt at the moment, financial debt. And I'm interested in how the value put on babies and children changes under sort of the logics of debt. I'm also interested in lived alternative models of pregnancy, birth, and parenting. I'm interested in exploring this as part of Laos's cultural heritage. I guess I'm pushing back against the idea that all of these things that women, you know, that 70% of women who give birth with no biomedical care, that they're doing it just because of some kind of lack or ignorance. Actually, my observations so far from fieldwork on different topics is that these people have a lot of knowledge already about giving birth and parenting. So I'll be returning to my established field sites in Jampasak and Sekong provinces, as well as starting new field sites in northern, central and southern parts of Laos. We're sort of going to the more remote areas in shorter fieldwork trips in partnership with birth educators and museum curators from the Traditional Arts and Ethnology Centre in Luang Prabang. And our aim is to produce a museum exhibition on material cultures of birth and parenting, an exhibition that I hope to show in Luang Prabang as well as Australia. And finally, I want to look at the interaction of mother and child health policy in Laos with these lived alternatives of what people already know about about babies and children. So for instance, I want to observe the visits that district health workers make on a monthly basis to villages for mother and child health checks. And I also want to observe the training that goes on in midwife schools. So there's a big push at the moment to collect women from rural and remote areas, young women like 20 years old, and send them off to get midwife training in the centres, and then with the hope that then they'll go back to their rural homes and provide biomedical care there. So I'm interested in how the transformations these women go through in these training projects and what orientation that gives them to the knowledge that their mothers and aunties already had about birth and parenting. And to give you some idea of why I think this is an interesting question, I want to tell you some short stories now about things that I observed in my previous fieldwork in Gandon village. And I think this shows the kind of context women who are birthing and who feel confident to birth at home are coming from, what gives them that confidence. And also it shows you some of the things I observed about low-level biomedical healthcare workers and their kind of contempt for local people and local knowledge, which is a puzzle because these often are regional and local people to begin with. So it's not like they're city people who have come out to the villages and have this contempt. They're actually rural people who have gone to training and then come back with this. You'll see. I'll tell you the story and you can draw your own conclusions. So in Gandon village, I lived across the road from a 20-year-old woman called Tong Mi, and she lived with her mother and father. Their family were one of the poorest in the village. Her mother, Ruas, was aged 46 and had 11 children. When I interviewed Ruas about birth, she emphasized that birth is usually easy. She said of her first birth, "Oh, it was only painful for a minute, and then we had a baby," with a big smile. She said that she had never been afraid of going into birth because, she said, the Mashnyai, which means the eye of the day, the sun, watches all of our behavior, and it's the sun that sends babies to worthy parents. So the arrival of children is a sign of the sun's approval. She said, those who care for us, meaning the sun and other gods or spirits that look after you, if they care for us, then I will stand. If they no longer want me to live, then I will die. So I wasn't afraid. Not all of her births went smoothly. Her first child died aged 3 months. Her fourth labour went on for 6 days. Her fifth child died aged 5 years old. The seventh was born bloated, and it was a difficult birth, and he died only 2 days old. And the 11th child was stillborn. Ruas explained these difficulties via the supernatural. Her first child died because Ruas had argued with a relative, and this angered the household spirits. Her 6-day labour on that fourth birth was brought to a successful resolution when her husband joined her in asking for forgiveness from the household spirits. The 5-year-old had died of a sorcerer's poison. She had not sought biomedical care for any of these crises, nor for any of her normal births. And she said, I've never birthed in hospital. Actually, I've never been to a hospital, but I think that my daughters should be able to if they want to. And her daughter, Tong Mi, did in fact give birth in a hospital for her first child when she was 18. Of that birth, Tong Mi said, oh, it's okay. There were people to help. If I birth in a hospital, I'm not afraid. And that child was 2 by the time I moved in across the road. But the father of the child had left, and Tong Mi had a new husband who at that time was in jail for transporting drugs. And she said that she'd wanted to go to the hospital again for her second birth, but this time she had no money. She said her previous husband looked after her, but this one was not able to. So mother and child healthcare is supposed to be free in Laos, but people in the places like Gandon say that there are still a lot of costs associated with going to the hospital. There's the question of how you get there, food and drink when you're there, and how your friends and family who might want to come with you, where can they stay and what can they eat. And there's also, for very marginal people like Tong Mi, there's a kind of unpredictability about going to the hospital. She wasn't sure if she'd be asked to pay for anything. So this meant that only those who were very confident in their financial situation sought care in a hospital. Tong Mi's second birth in the end took place at her home, attended by Ruas and her husband, who by that time had been released from jail. And Tong Mi said that the birth was easy. Labour lasted for 1 hour, and afterwards she rested for 3 days. And on the 4th day, she was out pounding rice again. When I interviewed her 2 weeks after the birth, She had still had no antenatal or postnatal checkups and had not registered the birth with any authorities. I went to visit her with my research assistant, a woman called Boy, who's also a local woman who lives in the village. And Boy was afraid on Tongmi's behalf. She said, "Oh my goodness, what if you can't remember the date that your baby was born on? And oh my goodness, what are you going to say when the health centre finds out you've had a baby and not told them?" Our visit to Tongmi prompted Boy to reflect on what life had been like when Boy was a child. Boy is about 30, 35 years old. And Tongmi, she says, was birthing now like our mothers had birthed, but that Tongmi's family was the exception because they're so poor. And most women in the village these days don't birth like our mothers, they birth like the Lao. So this is an ethnic Gandu village, and they've only recently, maybe since the 1990s, moved down into what they consider Lao country. Before that, they lived in the highlands technically of Laos, but they considered it quite far from Lao people. Boy said, women used to bathe themselves after birth gently, but these days, the Bothian, the lesson taught to us from the Lao, is to be very forceful and pour very, very hot water on the woman who sits closing her eyes, enduring it. It hurts. It turns into a gentle massage afterwards, but at first it's very rough. Boy would know this because she is the one in the village who often conducts these postpartum massages. And this practice is part of this general practice of heating up the body of the woman who's just had a baby. They call it yugam or yufai. So the woman is warmed and hydrated with hot things. This is often accompanied by a social event where men can come and play cards through the night. Tongmi's postpartum period had none of these features. A few weeks later, I went to visit Tongmi again. It was rice harvest time, and so her whole family had been sleeping in the rice fields. So I hadn't seen them for a few weeks. And they came back to the village specifically to get their children vaccinated at one of the monthly mother and child health visits to the village held by district health staff. So I went with her to the ceremonial hall in the central plaza of the village, where we found the health check visit already happening. You can see this child here is being weighed and measured. This is supposed to happen to all children under 5 years of age every month. And they also do other things like vaccinations. So Tongmi quietly put her mother and child book, which had no entries in it because she hadn't had any health checks so far, in the pile with the other women's ones. And when her name was called, she came forward. The nurse called out so that everyone could hear, "Where was this child born?" And Tongmi said, "In the village." "Why didn't you go to hospital?" Two nurses now asked this in chorus. "I didn't have access to a vehicle." "And who cut the umbilical cord?" Both the nurses asked this, their voices weaving in and out of one another. "My mother." "Ah," they said, "the intestines of your child will rot." The two nurses replied together in unison. What struck me in this grilling of Tongmi was its ritualized character. The questions and comments from the two nurses weren't spontaneous. The two nurses spoke in a tone that suggested a rote recitation of this kind of talk, as if the two of them had said it so many times. Indeed, the two nurses were able to deliver this series of questions in unison. Robbie Davis-Floyd suggests that this repetition and redundancy is a hallmark of ritual action. Tongmi was not the only mother to be hazed like this on the day. Even mothers who had done the right thing according to Lao policy, these mother and child health books that they were carrying say on the front of them, all births must take place in a public facility. So even women who had given birth in a hospital were still teased about other things, elements of their mothering. So when one woman came in and presented her little baby and said that its name was Jun Viet, the two nurses replied, "Watch out, she's going to turn Vietnamese," and laughed. And then they commented that both the baby was fat, but so was the mother, which they thought was terribly funny. And I had seen this woman trying to do sit-ups under her house, obviously concerned about her figure. But she laughed when the nurses teased her about her weight. Another child came in carried by its mother wearing no pants. And the nurses exclaimed, "Oh, where are your trousers? Your testicles are going to get splinters." And the mother smiled and said he had wet himself, so she took his pants off him. Now, at this time, I had two young children in the village myself, aged 4 and 2. And it was really, really hot. And my kids were always taking their clothes off. And I can tell you there was a tremendous social pressure in the village to keep your children clothed at all times. which might sound fine, except that most people in the village also told me that right up into the 1990s, people in this village, it was common for them to reach their teenage years without owning their own set of clothes. I've seen similar performances in family planning clinics where women are often given standard advice like, oh, 3 children is already too many, don't have another child, in a sing-song voice that carries it out throughout the whole clinic so that everybody can hear it. A kind of shaming like this, or a tactless joking, or giving loud, hackneyed advice in a sing-song voice, is entrenched in the micro-interactions of clinical care in Laos. Much of it is repetitive and redundant, indicating that it is ritualized and likely conveys the implicit values that come packaged with biomedical care. Tongmi had come to the meeting hall this day to get vaccines for her newborn, and she knew coming beforehand that accessing this kind of care for her child would mean that she would have to endure some kind of ritualized rebuke like this. And she did endure it. And when she did so, she giggled. When a male nurse administered the vaccine to her baby, he also asked her where the child had been born. And he actually made no comment or reply. But when Tongmi replied, as she had before, the child was born at home, the other mothers around her all laughed, and Tongmi giggled too. So what do giggles mean as a response to this kind of teasing? In giggles in Gandon, well, people laugh when there's a misfortune or they're embarrassed. Also, they laugh on behalf of other people when other people are embarrassed. So things like tripping over, or if your child throws a tantrum, if you drop something, if you fall off a bike, it's very common for all the people around you to burst into laughter in Gandon. And people say that if you instead look concerned or worried on behalf of someone else, or have a stern face or a look of concern, that indicates that you might be pleased that a misfortune has happened, and it might even mean that you caused it through willing it. But laughter suggests that one feels for and with the sufferer. The laughter around Tongmi then was something like fellow feeling for Tongmi's embarrassment, a sharing of its burden. This sense that healthcare is embarrassing is one of the greatest factors, I think, keeping people in Gandon away from medical centres. Boy, my research assistant put it succinctly. She said, if you're sore, sick, feverish, you have a cold, they always say it's because you're dirty. Even if it's true, it still makes me shy. Boy suffered from goiter for years before seeking biomedical care, preferring the herbal medicines and divinations readily available in the village over the disapproval that comes packaged with biomedical care. And birthing women, likewise, can readily obtain care from peers and support people in the village, who in turn draw on a rich stock of alternative knowledge, material culture, and attitudes. Tongmi's birth was attended by ruas, and ruas conveyed the message that babies are gifts sent from the sun to worthy people, a sign of the sun's praise and esteem. And if the sun wants you to live, then it will, so there is nothing to fear. In contrast, it takes guts to front up at the hospital. I observed women who had planned to give birth in the hospital, but when the day came, they ended up giving birth at home. Afterwards, they said that they'd just been too shy to go. Across many, if not all cultures, pregnancy, birth, and parenting are subjected to intense culture work, including ritual. This is as true of ruas's births as it is of biomedical ones. Physiological processes are not only interpreted through culture, but are influenced by it. Culture rashes up through complex feedback loops of communication and transmission between bodies, minds, and environments. Therefore, it's not only babies that are born at birth. It follows that the root and branch transformation of birth that is envisaged in mother and child policy, health policy in Laos, could amount to a seismic shift, not only in physiological, but also social and cultural reproduction in Laos. So that's my talk.
Thank you so much for sharing your work with us today, Holly. It's a real pleasure to engage with it. So we're actually ahead of schedule. So we've got about 5 minutes for questions specifically for Holly before we turn to Miguel's talk and a more general discussion. If anyone has a question, feel free to raise your hand, unmute yourself, or type it in the chat. And since I'm kind of putting everyone on the spot, I might go ahead and ask my own first question. I'm basically interested in what kinds of people are being made by the state here. And I ask it in a regional context. You know, just north of you in China, there's obviously the one child policy, but increasingly also a real exacerbation of earlier eugenic trends that got rolled out under the policy of quality children. Now you have ubiquitous genetic testing, and now you also have gene-edited children emerging in the clinic. So in this desire to medicalize pregnancy, what kinds of people and what kinds of populations is the state hoping to make, if you just take that seeing from the state point of view?
Yeah. My suspicion is that this is influenced by the concept of humans as capital, the human capital index, for instance, and the way I became the first thing that I wrote about how children are cared for and how that's influenced by policy was in relation to stunting. So there's a chapter on that in my book on Project Land. So I was very surprised to find out that this massive push to put toilets all through the village, which in the village is remembered as an attempt to stop, uncontrolled defecation. At the national level, when I followed this policy up, I found that it's actually all about creating a different kind of population. They want the population to be taller, and the World Bank has a serious policy based on some very shaky science, in my view, that is indicating that taller people have higher earning capacities. So that's when I mentioned about debt. I think that the World Bank is partly investing in or willing to back projects on mother and child health, things like nutrition, 1,000-day mothers and this sort of thing, because they want the population to be taller, because there are some people who seriously think that taller, intuitively, I think we can all agree that stunting is an indicator of relative deprivation. Shorter populations probably have had various forms of deprivation, but it's a perverse logic to think that making them taller will make them richer. That's you got the wrong end of the stick there. But I think that might be motivating at least some of these policies. But as always, there's been a lot of literature about how these, Laos has been historically very dependent on I guess the international development industry, so has been very influenced by things like the World Bank. But these policy international trends always have to be indigenized in the local context. And oh my goodness, so here we have my son has just come through the background. He's burst in. I'll mute myself then. Someone else could.
Super interesting talk. So Miguel, since we've got a little Zoom bomber, maybe we've got time for one more question if anyone wants to ask it.
Sorry, Eben.
Go ahead, Mauricio.
Ali, thank you for this. It was really, really inspiring, and I hope we can find the time to speak. There is also Natasha, my PhD student, who works on a related topic in India, so I hope we can find the space to discuss things. What I just to add, yes, this comment about the human capital is very strong. So we are writing an article with my former postdoc Tess about Africa and how much this measure of low birth weight is now taken as a biomarker of future success in job outcomes, market outcomes, education, etc. So this is a very powerful way through which the monitoring of birth has become an index of human development and capital development. So this is definitely an area that is worth investigating, and the developmental origins of health and disease have been instrumental in giving the sort of scientific evidence for this notion that the higher the birth at weight, the higher the chances to become successful in the job market, etc., etc.
And Holly, do you want to respond directly to Maurizio or take a bunch of questions? How's the Zoom bombing situation on your end?
The child has been carried out of the room. Okay. Yeah, I think, Maurizio, we just need to sit down and have a good chat about that. Yeah, I read some of those studies, like the Guatemala nutrition study, and it seemed to me that to the degree that there wasn't any evidence of higher income, this only applied to men, not women. And it only applied to men working in like the construction industry or something. So yeah, I think it's incredibly flawed. But Yeah, I'm interested in following it down the finance track, the World Bank. This is about loans, about financialization.
It has a particular attractiveness for economists because it gives a very narrow, low birth weight is quite pretty easy to measure, and and going to run statistics of what happens in 2-3 decades to them. So I know it's flowed scientifically, but it's definitely very much taken up as a measure by economists. They run in very large studies. One is about Ramadan, for instance, lower birth weight effect of Ramadan all over the world.
So maybe we'll take one more question, if there are any, and then go to Miguel's talk. David, I saw that you were unmuted a moment ago. Did you have a question? Maybe not. Okay, all good. Well, let's then go to Miguel and hear about a different approach. So I think part of the strengths of ADI is the multidisciplinary background. So we have anthropologists next to philosophers and scholars of politics and government. So Miguel, thanks also for sharing your work with us.
Thanks, Eben. Let me see if I can share the screen. And I didn't. Sorry about this. I'm not very good at this.
You might have to restart the share.
Is it, are you seeing this?
You got it. Yep, looks great.
Yeah, okay, good, thanks. And apologies in advance because my camera hasn't been working. That's why I had to get off and reboot. I hope, well, if I freeze, I just talk a little bit like that. Thanks, Eben and Chris, for inviting me to this event, and apologies for those like Maurizio and maybe Emma who are gonna be listening to me on Friday, because it's really about the same thing. So this is really I call that postmortem of a research project. So it's not about birth, but it's about how research projects die in a sense. No, it's kind of a joke, but I did put it in with a team last year at the ARC, and it did okay, but it didn't go up. And so I'm toying with the idea of putting it up again, maybe. And that's why I'm presenting it now, because I went back to thinking about it. I also have an ARC project on right now, which is related. It has to do about normativity in nature and in law. But this one, I want to talk about this one today. So it's really about rights of nature and trying to bring in a different category to understand this ongoing debate, which is related to or is a discourse on, or a new discourse, I should say, on trust and trusteeship, which has a checkered history, but I'll mention it very quickly. So that's a picture of the Wanganui River. So again, I'm a theorist, so I don't do PowerPoints. There are 2 pictures here or 3. This struck my attention yesterday. It was just yesterday on The Guardian, front page. Should rivers have the same rights as people? Actually, a very good article. It mentions a couple of Australian scholars as well. It seems this issue is not going away. There's now an international declaration of the rights of rivers, but I think it presupposes a new kind of thinking about where we're at, or where we're at with the rights of nature, and that's what my project was. So it was much more theoretical in that sense. Now, in terms of the relation to medical humanities, that's something that I will not talk about, but I will just highlight just these 2 quotes that were drawn from a recent book on One World and One Health. And here they say, maintaining the integrity of ecological system may provide the best, I can't even read this, I don't know, the best form of disease prevention. And another one says, granting independent legal status to the Wanganui River in New Zealand is another example of the emerging recognition that protection of the interests of non-human entities might be central to the pursuit of environmental health and justice. So that might, of course, is just saying that no one has really done any research on that, but part of that, or any serious research, part of that is just because these concept of what does it mean to protect the interests of non-human entities, is the way to do it through rights of nature or giving them an independent legal status? Is that the way forward? So there's so much theoretical and new thinking that needs to be done on this question of rights of nature, that then the connection to questions of planetary health, it's been linked, but it's all new. So that's what's interesting to me. So the big problem, I think, from a philosophical perspective is what is the foundation of these rights of nature? So in what sense does nature and or natural system have integrity, rights, intrinsic value, inner worth? Now, the first puzzle, philosophically speaking, is that at least in Western jurisprudence, persons have rights and not things. And so one of the big issues I think that we need to do in the theoretical space is to try to dethrone the distinction that is central to the West, Roman law, etc., between a person and a thing. I'll mention it a little bit later. But if you have this dualism, persons and things, then of course nature or anything which is non-personal and in a certain sense non-spiritual ends up being shunted towards a section of something as a thing and therefore lacking in rights. So in other jurisprudence, of course, this dualism is contested or doesn't even exist. And that's, of course, another area in which how is it possible to carry on a conversation between Western and non-Western jurisprudence or indigenous understandings of law and so on and so forth. I'm not going to get into that, but that's a very big topic. But again, I think that no matter what you come up with in one space, for example, in indigenous conceptions of law, indigenous knowledges, you still need to, our team and other people working this, you still need to deconstruct or take apart the conceptual apparatus in Western jurisprudence in order for there to be a meaningful dialogue between the two. Otherwise, it's not going to connect. And one of the big blocks here is this distinction between person and thing. I think the other huge problem in the debate on nature rights is that there's a tension between, on the one hand, a lot of environmental philosophers want to recognize that nature and natural beings have an intrinsic value and intrinsic worth. This is the very typical formulation for environmental philosophy. But on the other hand, when we speak, at least at the level of human beings, with someone having an intrinsic worth or dignity, we tend to think of them as being inviolable, that is, as entities that you cannot use them in a certain sense. Now, we all use each other all the time, but we also say that there's an aspect of us that cannot be touched, cannot be used, and that's what we usually ground human rights on. That's an idea of dignity or intrinsic worth. Now, does that make sense, even if it makes sense with human beings, but does that make sense to think about it that way with natural beings, given that ecosystems use natural beings, use each other all the time, right? So there is this big question of how do we factor in use together with rights of nature? So these are the philosophical questions. Now, what we were suggesting to do was three kind of attempts at innovation. The first one is to bring into the discourse of rights a conception of a community of shared life. And community of shared life, we would like to oppose it to traditional ideas of assigning rights based on conceptions of personality or personhood. That was the first, and I'll mention it briefly why we are thinking in that direction. The other important thing or innovation was to think of this word that is used a lot when it comes to rights of nature, and it's also in legal language, the integrity of nature and integrity of natural systems. So for example, when we speak of a river right, the first river right that comes up is the right to flow freely. If you start building dams or intervening in this free flow of the river, then that translates into you're not respecting the integrity of the river. Now, what I'm proposing is that to connect natural integrity to some sort of nature rights, I think the way to go is not to go the typical way, which is to start thinking about the intrinsic value and inherent worth of the river, but to actually reconceptualize or come up with a new conception of what dignity is. So in my own work in moral philosophy, I am part of a relatively new school of thinking about what dignity is, which tries to separate dignity from the idea of personhood, Before it used to be connected, and then you got the typical objections that, but dignity, isn't that too humanist? Isn't that species? It doesn't apply to other species. But actually, in the way we are trying to reconceptualize dignity, there's actually no species bias in the idea. And I hope that this is very recent work. Different people are pushing this, but if it is successful, then this would allow quite an easy translation from dignity, which is already considered to be the foundation of human rights, into or a parallel with natural integrity, and therefore allowing for a foundation of rights of nature. And the third element of the suggestion is to stop thinking of legal personality, including the legal personality of rivers or of the coral reef or whatever you want, in terms of, again, this Western construct, which is called the fictional idea of personality. Now, the problem is that Roman law and Western law is usually individual. So rights are assigned to individual, and on top of that, individual persons. Groups and communities do not have rights in our tradition. They only have them once these individuals make agreements with each other to incorporate themselves. And so they become a group, but it's a fictional group. And this is assigned certain rights. The problem with incorporation is that essentially the members of the group are always subject to a fictional head or leader, let's say. Now that's worked in modern jurisprudence to set up not only capitalist corporations, but of course, modern nation states. And the whole idea of sovereignty is actually based on a fictional conception of personality. Now, what my other work has been doing is I've been doing with other groups, it's also quite relatively new research. There is a trend in trust, in thinking about trust law and trusts, to go back archaeologically and to recover why did trusts come about. And it's really fascinating to see that the idea of trust, it can be argued that it's very transcultural. That is, but certainly in Islam, medieval Islam, there were conception of trust also in medieval Europe. But what is fascinating about this is that, especially in Northern Europe, and especially in England, for example, the idea of trust was invented really as a counter to the idea of a corporation, which was much more pushed by the church down in Rome for obvious reasons. Now, how much time do I have, Eben?
You did good.
I'm good. Okay. Let me go down some slides. Anyways, these are three things, and then I expand a little bit on all of them. I've already done that. Why community of life? Very quickly. Well, one of the big people in environmental philosophy, as you probably all know, is this man called Aldo Leopold, and he's the one who really brought up the conception of a community of life. And this is a quote: "When we see land as a community to which we belong, we may begin to use it with love and respect. That land as a community is the basic concept of ecology." Now, this is very interesting, not only because the human being belongs, let's say, to a community of life that is not purely human, and in that sense, it translates to all kinds of other non-Western knowledges, but also I think what is fascinating is this emphasis on the use. That is, that already once you shift to the community of life, using something when you're part of a community of life does not become so problematic as it is if you would say, well, nature has inviolable rights and human beings have inviolable rights that can disallow us from using it or from it to make use of itself. So that's, I think, quite interesting. And also the other important issue is that this community of life has sort of become part of international law, at least from the UN Earth Summit. But then, this opens a big question of how do you think rights which are so personalist, individual, based on this idea of community. Now, there are a couple of objections to community of life thinking. One of them does come from environment and says, well, look, when you start to think about the community of life, you talked about the stability, the integrity of natural systems, But these as such are facts. These are ecological facts, let's say. This is what keeps life going, but it does not give you a basis to say that this is what ought to be protected. The moral argument is missing there. And what you need is something much stronger, like, nature having intrinsic value. So that is one of the objections. The other objection is much more contemporary. It comes from earth system sciences, and this discourse around the Anthropocene, saying, look, we can't go back to the integrity of the earth or natural systems as it was prior to the Anthropocene. And so both questions of integrity and of inherent value are put into question, and rather there is a kind of attempt to introduce chaos and complexity theories now to rethink what our relationship should be to the earth. And this has led to some people proposing some jurisprudence that corresponds to earth systems, which would not have integrity nor inherent worth as the key normative terms, but they're trying to figure out something else. It's still not, still very much up in the air. I spoke about this. I mentioned dignity. If you're interested, we can talk about this a bit more. Here, just I wanted to refer very quickly to two theorists that I think are important in so-called post-humanities. And just to mention, one of them is Italian philosopher Roberto Esposito. And I think he's the one that has been emphasizing the need to get beyond, at least in the West, the person-thing, a distinction that is so central to all our political thinker. And the reason he says we have to get beyond it is because this dualism between person and thing understands rights as something that gives us immunity to the demands of community. So he has these two concepts that are playing against each other. So this is a very important insight, because all our legal categories, he claims, in the West are immunitary. That is, they protect us from too much community. We're scared of being together with other things, other people, even close people to us. So we get an over excess of rights. And this, according to Esposito, leads to a kind of autoimmunity problem. That is, we're too immunized and we need to lower down our immunities. And I think nature rights, if anything, has a use here because it is something, it's a paradoxical kind of right. It's a right that would allow us to, in a way, lower or take exception to our system of rights, also in environmental law, that is really designed to protect the human from everything else, okay? And here I just wanted to mention Braidotti, that you've all heard about, who speaks a lot about post-humanities, but I just wanted to emphasize that for her, everything about post-humanities turns on, she says, a new concept of life and, quote, technologically modified emphasis on life as Zoe-centered system of species egalitarianism. Now, I think she's right in the sense that this idea of life has led to animal studies, environmental humanities, multi-species, Eben, and so on, all this growth of discourses on life. But what is interesting is that she does not really address what she means by this species egalitarianism. And so that's where I think a very interesting possibility would be to develop a conception of dignity that is not species or humanist-based, but that does account for the possibility of giving legal status to non-human beings. And this, it seems, no one has figured this out. It's just an open question, an open call. And finally, trusts. The Wanganui River, the act that gives it a legal personality, is structured as a trust. I've talked to a lot of lawyers. No one knows what, when you set up a trust, it's like black box. No one really, there haven't really been a lot of cases yet. In fact, none really that's been adjudicated with the river as a legal personality in New Zealand. So we don't really know how this trust structure will act. But I just mentioned here, I just point out the idea of national trust in Australia as a, but I'm not going to talk about this so much. But the interesting thing about trust, and with this I close, as opposed to a corporation, is that the trust really allows for a break between the idea of users and owners. So the basic concept behind a trust is that people who own something cannot use it. I've frozen now. And people who use something cannot own it. And I think opening up this, as opposed to in a corporation or in normal law, where in order for you to use something, you have to own it. And I think this is the wedge that I think it's potentially interesting to open up, just because it will disconnect the idea of right from the idea of a property owner. Now, I know there's a paradox here because the way trusts have been used since the 19th century, but not originally, has been as a way to protect owners or private property. But as I said, there's new thinking in the trust space, in the legal theory of trust, to actually say that trust can be reconceived as something that protects the interests of things against persons, against human persons. And that's the potential that I see it. And if it's true, it could be potentially very useful, because the trust structure, especially in the Anglo-American sphere, is everywhere. It's everywhere. In fact, even some people argue that the very idea of a state, of the nation state, and of sovereignty is based ultimately on a kind of repressed trust structure and not on a corporatist structure as we've been taught. So this leads to, I think, interesting new possibilities. All right, I think I'll end there. I won't get into the sociology of stuff because I'll leave that maybe for my other talk on Friday.
Great, thanks so much, Miguel. This is another really generative talk. Does anyone have questions? This is really close to my own research, so I'm brimming with questions. Does anyone else want to go first? All right, well,
Eben?
Oh, go ahead. I can't see hands here. Go ahead, Maurizio.
Oh, sorry, Eben. Oh, Miguel, that was very fascinating. Can you hear me?
Yes, I can hear you. I can see you and hear you, but sorry, you can't see me. It's my.
And Miguel, if you could stop sharing your screen, then that'll open up the
yes
space for everybody.
Sorry.
Thanks.
Is that right? Oh, stop share. There we go. Sorry about that.
Perfect. Thanks.
Sorry, Miguel, sorry. My question may sound as probably very naive, but so what seems to me from the story you have told, and also from my general ignorance of the history of law, is that the way we think of law today is mostly a combination of the experience of Roman law plus some innovation in modern times to Anglo-American law. So I wonder, because this is a major problem in the history of science, in the history of medicine, I wonder if there is anything like a decolonizing law movement, because, you know, for instance, when you cite Esposito, you know, I tend to think of the Roman law experience he analyzes as just one form of indigenous knowledge. It's, you know, Roman indigenous knowledge, if you want. It was imperial indigenous knowledge. But in the same way, people have tried to understand medicine in a way that Hippocrates himself, is an indigenous thinker whose understanding of ecological relationship you can compare to other indigenous doctors elsewhere in the world. And many people have tried to write a history of medicine where they try to bring, for instance, Arabic or Ayurveda medicine or Chinese medicine as part of the medieval renaissance of medicine in the Latin West. So making a global history already in the making of the history of medicine. So I wonder, is there anything similar in the history of law where, because otherwise I have the feeling that it seems very much as something that has been produced between Rome and London, so to speak, needs to be applied to the complexity of the world. But maybe I'm wrong.
Yeah, no, it's the right, I think it's the right question. And of course, it's interesting what you say about Roman being indigenous, because sure, you can also say that when you read at the history of the trust, they believe it was really, at least in the West, invented or came up in the 12th and 13th century as a way, as far away as possible from the Roman Empire and the Christian Empire and Rome. So basically in the British Isles, in part, Northern Europe, and the Germanic tribes out there, as a way of pushing back the colonialization on the part of Roman law. So in a funny way, you could see that the trust, you could say the trust origin, if you want to be metaphorical about it, is much more indigenous, if you will, for an indigenous knowledge and a more indigenous approach to the connection between community and law than the one that was coming strongly from Roman law. And that was propelled by, let's say, this was the beginning of private property, right? Private property gets really invented juridically in the 12th, 13th century. So it was an attempt of the church to cash out its claim that it owned the world, basically, right? And it had, of course, important consequences for how capitalism and colonialism developed. I also think it's interesting, the New Zealand case, because they use the trust structure and together, of course, with indigenous representatives and indigenous knowledge to work out this legal act, which is meant to be facing both sides, both to Anglo-American law and to indigenous law and knowledges. And I think that's an open space, right? The same thing happens in Ecuador and in other eco-constitutional contexts where, you know, ecological rights are inscribed into the constitution by making appeal to Pachamama, Mother Nature, and so on and so forth. And that's still a very open space, you know.
Thanks. Chris, you've got your hand up.
Yeah, well, just following on from that conversation, I guess, yeah, I was thinking of a number of things that relate to my own research interests, but on this issue of Indigenous law in Australia, there's a number of Indigenous legal scholars sort of not wanting to do away with sovereignty. So Irene Watson and Megan Davies, and an edited collection from Eileen Morton Robinson about white sovereign subjects. No, not white sovereign subjects. I had it literally on this desk, and then I took it into my work desk, and now it's closer to Eben. Eben, if you went into my office, you get. But basically, anyway, we don't need to go through the whole contents of that book, but it's interesting to me the way that there are these, on the one hand, a move away from concepts like sovereignty in certain areas of legal and political theory, but other Indigenous groups are increasingly using these concepts, both, you know, reformulating them to, I think, explain some of their relationships to country and land, as well as using them, I guess, strategically to deploy them in these sorts of contexts like the river and other sort of claims in Australia. So, yeah, I guess I'd be interested to your reflections, Miguel, on the use and retaining things like sovereignty, for example. So Irene Watson, she wants to talk about a deflated sense of sovereignty, the way that Western sovereignty is, as you were sort of talking about with rights, is sort of all-encompassing framework, whereas she, using Dreamtime stories, talks about sovereignty in this, in her terms, deflationary way, where we can have multiple sovereignties.
Yeah, no, Chris, absolutely. It's a very, very...
Hold on one second.
Yeah.
Since we're transitioning to the next part of the program soon, I'm going to take Holly's question first and then let you have the final word, Miguel.
Okay.
I was just gathering my thoughts. I really enjoyed thinking about what you were saying. Possessive individualism has been a big sort of target of a lot of anthropological critique, of course, especially in the feminist streams, which I'll be engaging with in my project, and especially models of birth. If anything, it only seems to be getting stronger in Western countries, the idea that birth should conform. A good birth is one that conforms to what you would expect from a possessive individual, you know, like she plans her birth, she has her birth plan, she does, you know. Whereas what I've been playing around with in my work is that birth really challenges possessive individualism, because it challenges your experience of yourself as a rational creature and takes you into another side of human being, which is much more out of control. And I think I've been interested in this because I think birth in Laos, people are much more comfortable with the idea that the individualism is very limited. Like they have a concept of the individual, but they don't like expand it to like this meta theory of the explanation of all things that are good and right in the world. And there's two ways that they do that. In my paper, I was talking about their submission to a religious worldview in various ways, and also through socialism. And my observations of how Westerners sort of perceive this, it's horror. So it's not really on the level of, oh, I think we can come up with a better model for this, but it's more like, oh, these people are wrong and we have to change this. And I see this in these like gut rejections Westerners have of socialist ways of putting the community above the individual, and also gut reactions to like sort of despising the way people, for instance, women say that, no, I don't need to go to the hospital, the son's going to look after me. So I guess my question for you is, I don't think moving past the individual as possessor, like this isn't really a conversation. Like you can have these philosophical discussions, but in the end, people are very emotionally wedded to these ideas. So I wonder if you had anything to say about that. Yeah, I'll stop talking there.
Yeah, thank you for both very, very pertinent questions. I mean, to Holly, no, absolutely. But I think that's what Esposito is getting at, that our conception of our right is really an immunity device. And if we do away with this immunity, we're just going to be destroyed. And that's the horror, right? Because anything that is communal basically calls in us an immune reaction. Like, no, we cannot possibly have it. So that's, I think, very interesting. Also, I totally share, I mean, in my own philosophical work, I've written a whole book about this. The category of natality is a relatively recent one in philosophy. It's also shared by feminist philosophy, but it's fascinating and it has a lot of implications. So maybe we can talk about that sometime. It's actually a philosophical category that is become more and more important. And Chris, yeah, absolutely. I mean, in this original project, we work closely with the Australian Earth Law Alliance, and they work closely with a lot of Indigenous communities. And yes, that's it's an infinite conversation, source of issues. Yeah, there is, of course, an enormous ambivalence about nature rights, but I think it is because of this association, which I think, nature rights. So you want to make of country something like under a Western conception of right, a human right, and something inviolable, someone that no one can touch, no one can use, and that goes against our relationship, fundamental relationship to and with country. So that's why I think if we emphasize that, in fact, nature rights are not structured in terms of immunities and protection and violability, and you open it up to a radical conception of use, I think there is plenty of space for overlap here. But and on sovereignty, well, that's a whole other discussion. I have my ideas and stuff, but yeah.
To be continued. We're just getting started. So thank you both, Holly and Miguel. These were really generative talks. The conversation, I think, is going to unfold in the coming weeks and coming months.